Hi everyone, my name is Brittany Winans, and this is my research paper presentation, and we are going to be diving into dialectical behavioral therapy, or DBT, and its effectiveness in client crisis scenarios. An introduction. What is dialectical behavioral therapy, or DBT? Dialectical behavioral therapy is a specialized talk therapy designed to treat individuals experiencing intense emotions. It enhances cognitive behavioral therapy, or CBT techniques, by emphasizing the balance between acceptance and change, based in dialectics, the idea that two things can be true at the same time. DBT offers a structured approach to utilizing skills to assist clients with emotional regulation. It was developed in the 1970s by psychologist Marsha Linehan. Problem overview. Emotional dysregulation negatively affects mental health, often leading to crises fueled by intense emotions. This study examines the role of dialectical behavioral therapy in managing these emotional crises. DBT provides essential strategies to enhance emotional regulation and stability. We explore which components of DBT are most effective for improving crisis management skills, and the ultimate goal is to determine best practices in DBT that promote emotional resilience. On the right-hand side of the slide, you can see an excerpt from the DBT Skills Training and Handouts worksheet by Marsha M. Linehan, and it covers when to use crisis survival skills. You're in a crisis when the situation is highly stressful, short-term, that is, it won't last a long time, or creates intense pressure to resolve the crisis now. Use your crisis survival skills when you have an intense pain that cannot be helped quickly. You want to act on your emotions, but it will only make things worse. Emotion mind threatens to overwhelm you, and you need to stay skillful. You are overwhelmed, yet demands must be met. Arousal is extreme, and problems cannot be solved immediately. Do not use your crisis survival skills for everyday problems, solving all of your life problems, or making your life worth living. Theoretical framework. Dialectical behavioral therapy, or DBT, was developed by Marsha Linehan to help understand and treat borderline personality disorder, or BPD, using the biosocial model. What is the biosocial model? The biosocial model helps us understand a core symptom in borderline personality disorder, pervasive emotion dysregulation. According to the model, individuals with BPD have a biological tendency to experience emotions in a more intense and reactive way than others. This vulnerability, coupled with an invalidating environment, frequently communicates to the individual that their feelings are wrong or are overreactions. Over time, a person with BPD responds to their own emotions by invalidating themselves, experiencing difficulty trusting their own reactions, and becoming desperate to rid themselves of intense emotions. For our literary review, I established some research requirements when searching for articles. I wanted studies, independent variables to evaluate the effectiveness of dialectical behavioral therapy, or DBT, or its related theories. I also wanted favored dependent variables to decrease in severity of emotional dysregulation upon completion of DBT. Research should encompass a diverse set of demographics rather than focusing on a single population or diagnoses, and additional measures of success include reductions in self-harm and suicidal behaviors. Literary review findings. Research on dialectical behavioral therapy, or DBT, consistently links emotional dysregulation with suicidal ideation and self-harming behavior. One study of 57 adults with borderline personality disorder in a community clinic compared two modes of DBT, comprehensive DBTC and skills group only DBTS, and found significant improvements in emotional regulation, psychological distress, and quality of life after 6 months, regardless of the treatment type. Further studies show that DBT-based interventions reduce alexithymia, which is the ability to recognize or describe one's emotions, in improving participants' ability to identify and describe emotions. Across diverse populations, including individuals with BPD, autistic adults, transgender and gender diverse youth, adolescents, and older women, DBT consistently proves effective for managing emotional dysregulation and enhancing coping skills. Qualitative research with transgender and gender diverse youth highlighted the need for adaptations to DBT when working with specific groups, such as avoiding body awareness mindfulness exercises that may trigger gender dysphoria and prioritizing safety and interpersonal effectiveness training. The biosocial model provides a theoretical framework for understanding the emotional dysregulation that DBT aims to address. How does this influence our research design? Research proposal. I am proposing a non-probability mixed method study of established dialectical behavioral therapy programs to measure effectiveness of DBT treatment in managing emotional dysregulation symptoms of clients and emotional crises. The question: how does dialectical behavioral therapy, DBT, contribute to effective crisis management and client stabilization through emotional regulation skills? My hypothesis: as clients develop dialectical behavioral therapy, DBT, distress tolerance, and emotion management skills, their emotional regulation should improve and their risk of crises decrease. My independent variable: the client development of core dialectical behavioral therapy skills. My dependent variable: improved emotional regulation and crisis risk reduction. Sampling. I would like to target clients in crisis due to emotional regulation. We can further categorize these into clients with suicidal ideation and self-harm symptoms and clients without these symptoms. I want clients to be already enrolled in a DBT skills training program lasting at least 8 weeks. Weekly skills groups should be 1 hour each minimum. I would like to use a non-probability sampling method, including purposive sampling to select relevant participants, quota sampling to ensure inclusion of specific symptom groups, and I'd like to focus on clients already admitted into a DBT program experiencing targeted symptoms. Methodology. For measurement, I would like to include both qualitative and quantitative data. First, I would like to include the use of clinical questionnaire assessments. These including the PHQ-9 to measure depressive symptoms, the GAD-7 to identify anxiety symptoms, the Columbia Suicide Severity Rating Scale, or the CSSRS, to evaluate suicidal ideation and behavior, and the Perth Emotional Reactivity Scale, or PERS, to assess emotional reactivity. The design of this measurement is to have these clinical questionnaires filled out prior to admission to the study, and then every 2 weeks throughout treatment, with post-treatment assessments at 3, 6, and 12 months. I would also like to include clinician and client interviews to assess treatment progress in DBT. The idea is to have these interviews to offer a comprehensive perspective on the therapy advancement. They will serve to counterbalance self-report bias in the questionnaires and integrate multiple viewpoints, enhancing the evaluation of the treatment efficacy, and this approach is to ensure a more holistic understanding of client development. These interviews will take place prior to admission to the study, every 2 weeks while in treatment, and a post-treatment at 3 months. Procedures and limitations. Select intensive DBT programs to participate in the study. We will screen participants using the PERS and CSSRS CSSRS for emotional dysregulation and suicidal thoughts. Baseline assessments will include the PERS, the CSSRS, the PHQ-9, the GAD-7, and a baseline interview. Biweekly assessments will monitor symptoms, and treatment progress interviews will continue to monitor throughout the program. The end of treatment evaluations will happen at 3, 6, and 12 months for to study long-term effectiveness. The limitations include high costs, limit access to affluent areas, reducing generalizability, inconsistent outcomes due to variable DBT accreditation training, and ethical concerns to restrict untreated control groups in studies, and a general focus on borderline personality disorder in DBT research narrows diagnostic diversity. Thank you for watching my presentation. Listed below are my references that I used in this poster. I hope you enjoyed learning a little bit about DBT, and I am very excited to read all of your questions and comments in this post. Thank you.